Dr. Doreen 𝗏𝗓𝗃𝗧 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗏𝗃𝗧.
Dr. 𝗏𝗏𝗃𝗧.
Dr. Doreen 𝗏𝗏𝗃𝗧.
Dr. Doreen 𝗏𝗏𝗃𝗧 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. The first question that we have is, my 8-year-old son has made great strides, but we are still struggling with the ability to focus. He has a hard time paying attention or finishing a task. I ask him to do something and it seems to go in one ear and out the other. The teacher says that it is his greatest challenge at school. I think that's a pretty common sentiment that people have, say to us over the years, is this ability to focus. So help us, Dr. 𝗏𝗏𝗃𝗧, what kind of skills do you teach to sharpen that?
So that's an awesome question, because it's one of those situations where lots of different things could be contributing to this kind of difficulty to focus. So like everything else with autism, you have to think of the individual differently than anyone else, and you have to look at them as an individual and ask yourself a lot of different questions about why they are having a difficult time focusing. So let's try to go through some of those things that I would ask if a parent told me that. And I think it starts with making sure that we're all referring to the word focus as meaning the same thing, right? So we're looking at focus. For instance, some children will have a difficult time focusing on something, either because they are just very distractible, or because they have issues with the stimulus input. So, and each of those will have different, I guess, causes or potential causes. So the very beginning thing that I would say is, okay, make sure the child has you are giving them information through senses that they are able to receive information from. So in other words, some kids can focus perfectly well if you give them visual information, but they have a very hard time focusing on auditory information, like instructions that are verbal, vocal. And, a lot of my kids who have gone through the years and have, we've known them for a long time, have said to me later on that they had difficulty hearing the sound of conversation because they were so sensitive to other background noises that were going on that normally we don't have that difficulty. So, I always give the example that like, let's say you're in a room with someone and you're having a conversation, there could be 10 other things going on in the room. You could, background noise of, let's say, a fan or trucks or cars in the street or a dog barking or other conversations or, plates in a restaurant, whatever. There's all this other stuff going on, but you have the ability to do this thing, which is like figure ground discrimination, right? And you have the ability to focus on the sound of language. Now, we're given that ability just because we have grown up with these sounds and are not only our inner ear hair cells in our ear have become accustomed to recognizing those particular sounds, but so has our brain, right? And we've become very able to focus on those particular sounds because they have meaning. And for a lot of our kids, it's very difficult to do that. It's almost like they're hearing a less, I guess, obvious sound. Like one of my kids actually told me that the sound that was the most prevalent for him or most pervasive in his head was the creaking sound of doors or various other sounds. And so language was somewhere in the background and he had to really focus on that. And the same is true for visual type of input. And some of our kids have a very, very difficult time with even visual input because they are not able to scan, they're not able to track. As you know, Shannon, they have difficulty with things like facial recognition because the movements of the face are difficult for them to decipher and understand. There's a lot of stuff like that. And this has to do with sensory input, right? Sometimes sounds or sights can be too harsh for them and overwhelming. And just that aspect alone will interfere with the child's ability to focus on a particular thing. Now, assuming the child has overcome that, or that is not actually the issue, then we can get further into it and talk about inattention, right, or the ability, distractibility, and all the things that lead to that. Uh, just not being able to stay focused on a particular thing for a period of time to benefit from it. And of course, a lot of our kids have the same symptoms as kids do with ADHD, where they're easily distractible. So anything in their environment, something fluttering outside might distract them. Because remember, as I said, they might be more sensitive to those types of sounds that normally we would not be distracted by, but they are, because they're hearing, for instance, a lot of my kids will hear something like an airplane coming way before the rest of us do. So that is, of course, easy to get distracted because all these other sounds that are lower for us are not for them. And so they will turn to see what it is, and they're curious. Visually, the same thing. A lot of our kids don't have a kind of proper closed visual field, and they are looking at too many things. In fact, one of my kids here that I'm working with has a real difficulty with just keeping his eyes focused on the pertinent stimulus, whether it's a person or an object in front of him or whatever it is. He's just not able to keep his eyes on that particular stimulus. So those are some of the things. Now, of course, getting over all of that, then there's other issues like things having to do with just attention. And as we know, a lot of our kids have difficulty with attending the way we do. And there's lots of different types of attention, and we take it for granted, right? But there's, for instance, divided attention, which means that you can shift your attention from one stimulus to another rapidly. And that you see that with typically developing kids who are, like, let's say, watching TV, and mom calls them from the kitchen. And they break and take a look while the TV's gone, they go back, right? Being able to shift back and forth. That's a skill that could be practiced. Or the ability, as I said, to focus on, like, if someone calls your name, most of us will attend to that and put everything else in the background while we're responding to our name or particular key words or things in the environment that are important. Like someone shouting fire. We'll put everything else on hold and pay attention to that. So you can teach the child what the key elements are, but you also have to help the child go slowly and shape that behavior, because it is difficult for our kids. For instance, if a child can't really pay attention to, let's say, a teacher in a classroom, I'm not going to just try to tell the child continuously to pay attention to the teacher. I'm actually going to help the child first pay attention to something that is possibly closer and in less of a distractible field. And I'm going to reward that, and I'm going to try to maintain contact with that, and so that the child has a longer period of time paying attention. And then I'm going to gradually move it further away. And then I'm going to put other distractors in the background so that the child knows that even though the teacher might be standing 2 feet away or 3 feet away, and there are other things in the background, I am supposed to be looking at the teacher and listening to her. And, this is a shaping procedure, and these are things that you can teach the child to do behaviorally. And there are lots and lots of lessons that can help the child shift attention rapidly, pay attention to the most prevalent type of stimulus in a background, both visually and auditorily. And those are things that you practice. Now, again, there are other kind of biological things that could affect one's attention or focus are things like, is the child sleeping? None of us focus very well when we're not sleeping. None of us focus very well when we're too hyper, which could happen to our kids based on their diet, on the amount of sugar they're ingesting, all those different things. So every child is different, and you really have to ask yourself, what is it that the child is not able to focus on? And in most cases, you need to teach that behavior in gradual steps, because basically it's a very abstract and difficult thing for children to know exactly what to focus on, how to remain focused on that stimulus, and how to, block out all the other distractions.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.